All right. Okay, so my name is Sinkat Vyas. I'm a doctor of physical therapy at Shore Care Therapy and Wellness. And every Friday, we're gonna be doing live feed, and I will be talking about different topics every week. If you have any preference, please send us the request and I will try to cover those topics. Now, the goal for the sessions is mainly to educate people, of course, and to make sure you know what to do when you have a flare of pain or something like that. Okay, so we need to make sure that, like, you're comfortable, you follow the all instructions, and you can do your follow-up when you have a flare-up or any particular pain at that time. So today I'll be covering back pain, and I'll be discussing about 9 easy tips that can manage your back pain. Okay, if you have any question throughout the session, you can put in a comment and I'll try my best to give the answer to that. Okay, and let me see. Okay, we're just gonna wait 1 or 2 more minutes if more people want to join. But just to give you some background, that I we have a Shore Care Wellness, which is located in Carrollton, and we opened almost like a 2.5 year now, and specialized, like, in many fields, but any chronic pain, back pain, neck pain, joint pain, we can definitely help post-op, vestibular training. We're also specialized in Parkinson. I myself is ALS-50 certified, so we can definitely help you with all those issues. Okay, so again, every Friday, 6 p.m., we're gonna be announcing what topic we will cover the following week. Most probably by Monday, we will let you know like what topic we will cover. So if you have any request, just let us know by weekend, and whatever the most requests I have, I'll try to cover those topics. So let's try to cover that 9 easy tips that we were talking about, that how you can take care of your back pain. So first of all, let's talk about, like, the many time patient asks me, what is the most important thing, or what are the best 3 exercises I can do to take care of my pain? It's not best 3 exercise. What you need to do is understand the trigger points. As long as you take care of your trigger point, you can manage your pain, because that's the most important thing. You go to the physical therapy, you go to the chiropractor, you go to the primary physician, take your medication. But if you're slouching in your job position, so 8 hours a day you're slouching, or 8 hours a day your posture is not right, and then again you're gonna keep on coming, the pain will keep on coming back. So you need to adjust that. Now let's talk about some of the myths that I hear a lot. My back pain is hurting and due to strain, and it will get better by itself. In some minor cases, yes. If you slept wrong, yes, it will get better in some days. It is more alarming though when it doesn't get better in 1 or 2 weeks. If it lingers around throughout the time, you tried something, didn't work, then don't try to figure out. Don't try to just like Google or YouTube and trying to find the tips. And just because every individual is different, okay? So you need to make sure that you understand why the pain is still there, okay? So that's another one more thing, is that in Texas now we have a direct access with physical therapy. So 10 business days we don't need a physician's order, but after 10 days, so that's a perfect time. So you come, let's say you flare up something, and you come here and we figure out, like, in 10 days that, okay, something simple, we can take care of it, we can educate you, we're good. But if something needs to be further, more require attention, then we can reach out to your primary physician and get the order after that. All right, second thing is I'll get the massage and it will get better. Yes, it will get better. I see, yep, one question, that's hard not to slouch. Yes, of course, because one fun fact for that. Okay, try to watch any kid, any small kid, they will never slouch. They will be always like this. Observe that. Any kid around, just observe. They will never slouch. They will always stay straight. Why? Because when we are not, our body is not meant for this. Our body is meant for straight. Their muscles are really nice and tight, and everything is good in the kid. As we grow, we get our bad habits, and then we start slouching. Okay, and then it start getting that bad posture. Okay. All right. Mahek says hi. Hi, Mahek. I'm glad you're here. That's good. Okay, so second is that I'll get massage and it will get better. Massage is a good maintenance. Yeah, we offer even the massage at the Shore Cure. Yes, because that's a good maintenance. Like if the pain is keep on coming back after each massage, like let's say you have a massage, you feel better for a couple of days. In a week, again, your back pain come back. And then again, you go for a massage. It feels better a couple of days. Same cycle happening. That means something is more than just a strain. That is the time you wanted to make sure you consult with someone to see what's going on. Okay. All right. The third one is that I'll take some pills and it will get better. Yes. Tylenol is like, I'm not sure, but like I think I read somewhere that Tylenol is not a candy. So you need to make sure, like, every medication has a side effect. Sometimes here and there, if you take it, that's okay, but you should not be having a habit. Okay, so if you're taking every day, you have to take one Tylenol just for a back pain, you wanted to consult someone. Okay, so now let's get back to our 9 tips that we were talking about. Okay, so the first tip, avoid high heels. Okay, most of the time people ask me why it's how it's connected, how my back pain is affected by the high heels. Okay, just imagine that you increase the height by putting the platform on your shoes. Okay, how you're going to compensate, how your body is going to compensate. Of course, when you are wearing the high heel, your body is not going to go like this. Okay, so what it does, it goes like this. So it increases the curvature on the bike. Now, when you increase the lumbar curvature, you're putting extra pressure on your lumbar. Okay, 25% of the pressure increase just by wearing a high heels. Okay, so if you like once in a while you're wearing it, okay, no problem. But if you're in a habit, if you're going to the work and you're consistently wearing that high heels, eventually not only is going to affect your legs, your ankle, but it's going to affect your back as well. Okay, so you need to be careful when you choose your shoes that you don't consistently wear that. Okay, the second thing is that avoid sitting more than 20 minutes. Okay, why you need to avoid sitting more than 20 minutes? This is foam, it's very light. Okay, I can hold it. Okay, I can hold it. Can I hold this for 20 minutes, 30 minutes? It will start hurting on my shoulder, right? Why? Because of the gravity. So when you're holding something, or when you sit down, your pressure build up on L4, L5, L3, L4, L4, L5. Those are the spot that your pressure build up. Okay. Now, when you stand up, your pressure goes in your leg. Okay, it goes on the spine, to the hip, to the knee, to the ankle. When you sit, all pressure build up on your lumbar. That is the reason nowadays you must have seen a popularity in the standing desk, which is a good idea to have it, because you don't want to just stand up, or you don't want to just sit down. You want to keep on changing. Okay, you stand up for a while, then you sit down for a while, but 20 minutes is a kind of a time frame. If it's a 20-minute, change your position. I'll give you one tip. Let's say you're standing and cooking. You're cooking for 2, 3, 4 hours. Okay, the best thing to do, have a small stool in the kitchen. All you need to do is put one leg on that stool. So you see my whole body shifted on the one side. So right now, my whole weight is going on the left side. 10 minutes, switch my leg. Okay, so what I'm doing is I'm constantly changing my pressure. I'm constantly shifting my weight. Okay, so it doesn't build up in the one area. Okay, and again, as I said, standing desk, sitting desk, and ergonomics at your job is most important. If you're sitting too long, like 8, 9, 10 hours we spend at our job. For that, if you have to get some modification, like a lumbar pillow or something, make sure you do it. Okay. All right, let me quickly, before we go for our next tip, let me see if anyone has the question. Okay, which shoes do you, Mahek asked, which shoes do you recommend to help support your arch and back? There is a Hoka, which is a good brand, which gives you really, if your job required standing too long, that is a good brand. Also, the New Balance is a good one too, because they're not fancy, but they're more supported. Okay, so that is good too. But the most important thing is, even you can go with Nike, Under Armour, but go with the specific design one, because the running shoes are different for a reason versus walking shoes or different type, because they're designed differently. Because when you run, your different, like, you know, your posture, your weight bearing is different versus you walk. That is the reason, like, you know, that depend on your activity, you can choose different shoes. But again, if you're requiring too long standing or, like, you know, walking at the job, Hoka is a good one too. New Balance is a good one. One fun fact again, okay, your shoes has a mileage, okay? So about 500 mileage. So let's say you walk about 1 mile a day, okay? So 30 days, which is 30 mile, okay? So you can go maybe 10 months, which is 300 mile, okay? So I would say about a year and a half, that is the limit of your shoes. You want to change it. If you're going for 5 mile a day, then of course you have to change your shoes earlier, okay? So there is no fixed thing, okay, every 6 months or 12 months. It depends on your activity. If you're walking too, like, you know, long distance, yes, you have to change it too fast, okay? And if you're just, like, you know, here and there at the job you're wearing it, it may last longer, okay? You don't need to keep a track of the mileage, but you can try. just simple, like, you know, tracking. All right. Okay, so all right, it's Kalpitaben is here. Hello, how are you? I'm glad, like, you know, I'm trying to share all the information, so that's good. Okay, all right. Now the next one is use ice versus heat. Many times people have a question: should I eat ice or heat? Okay, you should ice. Ice is much better than the heat. Heat is only good on your tight muscles. If you have a spasm or if you have like a tight muscle, heat is good, okay? That will relax the muscles, okay? But if you have inflammation, let's say you have a pain right in the center of the back, okay? That is the time you put the ice on it, okay? Why? Because that ice will reduce the inflammation. It will reduce the swelling in your disc, okay? So ice is more important in your spine versus your heat. But if you have a tight muscle, paraspinal muscles. When I say paraspinal muscles, means like muscles on the side of the back. When you feel like tightness on that area, use the ice, or use the heat. Okay, that will relax the muscles. Okay, avoid sitting cross-leg. Okay, if you sit too long for cross-leg, our body is meant to keep like normal anatomical position, which is neutral. Okay? Everything has to be neutral. Anything opposite, it's gonna start affecting if you do for a long period of time. Okay, if you're just like, you know, sitting for a short time for meditation, that's okay. But if you're sitting for many hours like that, it's gonna affect you. Okay, why? The reason is because when you do the cross-legging, your hips are going out. When the hips are going out, it does affect the pelvic. Okay, when the pelvic is affected, because pelvic is connected with the spine, and then the spine is affected. Okay, so it's all interconnected. So whenever you're doing the cross-leg for a long time, that's the problem. Okay, so you need to make sure that you don't do that cross-legging too long. Okay. Okay, the sleep with the pillow in between the legs. Okay, many times sleeping, many people has a question: how do I sleep? One, what is your habit? Are you a side sleeper? Are you back sleeper? Are you stomach sleeper? Of course, no for the stomach sleepers. Still, if someone, that many times we ask, like, you know, that if I cannot sleep but I have to sleep on the stomach, there is a way you can do it. You can put the pillow under the pelvic area. You can put the pillow under the ankle. But as I said, it's not advisable. What you need to do is sleep either on the side or on the back. Let's say if you're sleeping on the back, then you wanted to put the pillow under the knee. Why? Because our lumbar, your lower back, has a curvature. That's a normal. That's normal curvature like that. That's called the lumbar lordosis. Okay, so that has to be supported. So when you sleep flat without pillow under the knee, what happened? That curvature stays like this. Okay, the gravity pushes down on it, and lots of pressure build up throughout the night. When you bend your knee by supporting the pillow under the leg, when you bend it, that flattens that curve. Okay, so when that flattens that curve, your whole back is supported. Okay, and that is the reason you want to keep the pillow under the knee if you're back sleepers. Let's say if you like to sleep on the side. So when you're sleeping on the side, you wanted to keep the pillow between the leg. Why? Because if you sleep on the side, your leg is crossing. Okay, so when your leg is crossing, you're pulling whole pelvic area. Your hip is going in. So when your hip is going in, your quadratus lumborum, your muscles on the side pull. Imagine whole 8 hours you're sleeping on the side, and that tension build up on that side muscles. Then in the morning when you wake up, you say like, I don't know why I feel stiff. Okay, so those are the small things that does affect us. Okay, so those things you want to make sure you give a good thought about it, like what you should do to make sure. Okay, all right. Again, as I said, another tip is avoid sleeping on the stomach, because as I said, that's not recommended. But if someone has to, then it has to be properly supported, and like proper pillow has to be put it there. Now, another thing is the mattress. Many times question is asked, what kind of mattress should I use? There is a myth that if I have a back pain, I should sleep on the firm mattress. That's not correct. It is depend on your body type. It is too generic to say that, okay, get the firm mattress and you're good. No, it's very generic. So it depends on your body type. You need to select which mattress is right. Now again, every 5 years you want to change your mattress regardless. There is no mileage on the mattress, but you want to change it. Every 5 years, change it, okay? Because it does that, the texture, the compression, like everything changes over the time. So you want it to change every 5 years, okay? All right. Now, when the pillow also, that I'll cover the pillow topic when we cover maybe neck pain at that time, because there are so many details on the pillow as well. But at least for the mattress, make sure I usually prefer not too firm, not too soft. But again, it's depend on the person. Some people feel better with the soft, and some people feel better with the firm. And my idea is to have like a neutral, not too firm, not too soft. Okay. All right. Okay. So the second one is choose sensible footwear. As Hack asked, like what kind of shoes you need to wear, because you're standing too long on your feet. That does affect your posture, because posture is the key. It what kind of shoes you wear does affect your posture over the time. So you wanted to make sure you have a proper shoes. You change it on the timely manner. Don't just keep on wearing the same shoes over and over. Okay. So just follow those instructions. Okay. And the last one is get the physical therapy. If your job required repeated, let's say, lifting job. Let's say if someone is working in the Amazon warehouse, okay, they need to lift lots of boxes, okay? So that kind of job required lots of lifting, okay? First of all, of course, most of the big companies do provide the training. But again, depend on you. Those trainings are very generic, okay? It depends on your body type. It will be different. Not only lifting technique, of course, lifting technique is very simple. You can just keep the box close to you, bend your knees, don't bend your back, make sure it's normal, the back is supported, like it's straight, not curved. Those kind of things is good. But you need to make sure that you do the proper posture screening, so understand your body. Okay, so it's very important that you understand your body. So when you come to the physical therapy, when we consult, we do thorough assessment where we ask you many questions. Okay, what kind of job you do, what kind of movement you do. You won't believe that many times I keep on asking questions, and at the end I get something. Okay, that's the one that is causing the problem. Okay, so I'll give you example. One of the patients, that we were working on back pain. He comes, we treat the back pain. He feels great after the session, and he felt much better after, I would say about 2-3 weeks, and he felt much better. He was very happy. He was able to go to the gym and started doing whole exercise and everything. And after 1 or 2 weeks, he came again and said, no, I'm not sure, my back pain again came back. And then I said, are you following my home exercise program? Because that's very important that you do that. And he says, I'm following everything like what we discussed, and everything is, I'm doing it right. And then I said, okay, you know what? Let's do one thing. Let's repeat everything. Let's see what you're doing. So he was hitting the gym at that time because he was feeling better. So I watched each and every exercise that he did in the gym. At least 3 to 4 exercises he was not doing right. So he added more exercise. Of course, you wanted to start doing more exercise. But if you do one wrong technique over and over again, it's gonna affect your body. Okay, So it's very, very important that like, you follow the ergonomics and everything. So it's very, very highly recommended that like, if you don't know, have a one session with therapist. Just go over like, your need, your requirement, what your job is, and if you have any like, back pain is going on. And we can definitely, like as I said, like we have a direct access in Texas for 10 business days, so we can definitely see you directly as well. Okay. All right, so those are the tips, the 9 tips. Let me quickly recap it. Okay, so the one is avoid high heels. Okay, avoid sitting too long for 20 minutes. That's the second one. The third one is use the ice more than the heat. Okay, the fourth one is avoid sitting cross leg. Don't cross your leg. Then fifth one is sleeping with the pillow between the leg. Okay, and all right, I think Mahak is asking question, do you take M-Better yet? No, M-Better says no still, because we did apply M-Better to get credential. Again, they're saying they don't need us yet. So we'll keep on trying and we'll see how it goes. But yeah, we accept many insurances. We accept Medicare, Blue Cross Blue Shield, Cigna, United, WellMed, AmeriGroup, Molina. We accept many of them. I think you need to call the AmeriGroup and recommend us to get credential. We're ready to get credential, but I don't know why they're saying no. They're saying their network is full. Yes, you can definitely come. We can definitely see you. Miss Virginia asking where you're located. We are located in Carrollton. We are right outside the Castle Hill. We are on the Josie and King Arthur intersection. It's a medical complex. We're in the backside, and now it used to be Baylor Hospital, but now it says Carrollton Regional Center. So north of the Josie, we're right on the left side. Yeah, definitely. I will looking forward to hear you on Monday, Mahak. Okay. All right. Okay. So as we were saying, the cross leg, then pillow between the leg. The 6th one is avoid sleeping on the stomach. The 7th is change your mattress every 5 years. Okay. 8 is choose sensible shoe wear, and 9 is get physical therapy with physical therapist. All right. Some more tips. Morning and evening stretching. It takes 1 minute to stretch. Just imagine in the morning when you wake up, bring your knee to the chest alternatively, 20 seconds. Okay, bring your both legs. Okay, so basically, okay, I'm gonna see if I can show you. Okay, all right, 1 second, let me see if I can show you. All right, okay, so the one is just 20 seconds of this. Okay, make sure the head is down. Okay, then you can go this. Okay, and when you sit, okay, pelvic tilt. Okay, so there are many different stretchings available out there. Okay, but on the you can do it on the bed. That's fine. That's fine. You don't need to go on the bed, on the floor, and do it, because as I said, this is a quick stretch. So you can literally put the timer on your phone, just 1 minute. Okay, so 20 seconds. Put this 20-second repetition, like so 20 seconds for knee to chest bending, 20 seconds for side to side, 20 seconds for pelvic tilt. And there are, like as I said, if you have more time, there are different stretching you can do, and believe me, that will really help you. Okay. All right, welcome, Chintan. If you have any question, please feel free to ask any question. Okay. All right. Okay, so again, every Friday we will be live and we will be covering different topics at 6 p.m. Okay. If you have any preference for covering, so the topic, just to give you idea, like what kind of topics we'll be covering. So neck pain, shoulder pain, knee pain, arthritis, okay, balance issue. If you're someone like, we can cover maybe Parkinson one day. So there are so many different things that we can cover. Okay. Yes, I am. Ms. Virginia is saying I'm very bad at being consistent with stretching. Consistency is a key. Okay, in our clinic, we have put the posters right there. This is right over there. We have a posters. One of the posters says that suffer the pain of discipline or suffer the pain of regret. Each and every poster has specific meaning to the question of the patients. Okay, so yeah, tight hips. Yes, okay. One of the things, like, for the tight, if you have a tight hip, it does affect the back pain too. Let's say if your front of the thigh, uh, okay, so if you're talking about covering the topic like a hip topic, yes, we can definitely do that. The tight hip, we can cover that. Shoulder pain, yeah, okay, definitely. We'll do that for sure. But yes, the tight, like, just the one, like, quick information. If you have a tight hip, it does affect your back pain. How? Let's say if your front of the hip, like right here, is tight, the hip, it's called hip flexors. When that is tight, your pelvic your pelvic goes forward. Okay, so whenever your pelvic goes forward, you're increasing your lumbar curvature. Okay, there is a way we can find out. There is a spatial test. So when you come to the physical therapy, what we do is a spatial test. So the spatial test is basically just for ruling out, like, what causing it. So we look for individual muscle length, like which muscle is what is the length of the muscle, which muscle is tight, which muscle is not tight or like weak. Or we can look for the spinal mobility, like is it hypermobile or is it hypomobile. When I say hypomobile means stiff, and when I say hypermobile, that means, like, the stability is not there. So once we find out, we will definitely be able to tell you more in detail what's going on. But yeah, definitely I'll consider that request, the shoulder pain, the tight hip, and we will go from there. Okay. Okay, so just a quick information. Again, this is Sure Cure Therapy and Wellness. My name is Sinkat. I'm a doctor of physical therapy, and our clinic number is 469-212-8888, or you can visit our website, which is www.surecurewellness.com. Okay. You can definitely give us the messenger, like, send us a message on the Facebook or call us, and we will be able to help you. Okay. All right. Okay, so I will see you again next Friday at 6 p.m. Okay, I don't see any more questions, so I will definitely keep all those suggestions in mind, and we will see you next week. All right, thank you. All right, you all have a good weekend. Bye.